I'm delighted to welcome you to this special product live session. Today we're coming live to you from Wound Care Today in Milton Keynes. I'm here with Lisa Wood, who's going to tell us about ConvaMax.
Hi, thanks Joy, and thank you Wound Care Today for inviting me. My name's Lisa, I am clinical specialist for ConvaTec, and before I joined ConvaTec, I was a tissue viability nurse in North London, and I currently have an honorary contract where I work in 2 complex wound clinics in Buckinghamshire. And I'm here today to talk to you about our latest addition to the ConvaTec family, which is ConvaMax, which is a super absorbent dressing. So ConvaMax is a really absorbent dressing that's designed to protect the skin against excess exudate. We know that excess exudate will cause problems with skin integrity. ConvaTec have been creating fabulous dressings for the past 25 years, and those dressings have been tried, tested and trusted by clinicians all across the world. So ConvaMax is our latest addition to this family. We know that wounds heal faster in a moist wound environment. In fact, they will heal 2 to 3 times faster in a moist environment than they would in a dry. So exudate is a really good, positive thing. However, we know with most things in life, too much of a good thing can be bad for you. And that's the same for wounds that are becoming too wet. There's a risk that excess exudate can start to break down the healthy tissue surrounding the wound, causing maceration and in some instances excoriation, which can be really quite uncomfortable for the patient. And it's also a really good breeding ground for bacteria to create more problems for that wound. So it's really important that we manage those wounds effectively with a super absorbent dressing. So you would use ConvaMax wherever you've got a wound with a high level of exudate. So that could be anything from a leg ulcer, a pressure ulcer, a diabetic foot ulcer, or it could be a dehisced surgical wound. Anywhere where you've got a high level of exudate is where you could consider using ConvaMax. So the image you can see on the screen at the moment is a nice example of a wet leg. You can see where you've got that healthy epithelial tissue on there that's becoming macerated. It's that white, boggy and soggy tissue. If we don't manage that excess exudate effectively, there's a good chance that wound is going to start to break down further and cause more complications for the patient. So it's really important for the best outcomes for our patients that we manage that excess fluid effectively. So the main features and benefits really of ConvaMax is the fact that it is a really absorbent dressing. It will absorb a high amount of exudate even under compression, which is really important because a dressing that just absorbs and allows all that fluid to then come back down on the surrounding skin when there's pressure applied is really unhelpful. ConvaMax is really good at absorbing and locking in that excess fluid within the core of the dressing. And doing that, it prevents that peri-wound maceration, excoriation, and it reduces the risk of that dressing leaking, causing problems and discomfort for our patients. ConvaMax will retain that bacteria and that fluid within the core of the dressing, reducing the risk of bacteria causing problems for that wound bed. And ConvaMax is actually a protease modulator. It reduces the proteases within the wound bed, trapping them again within the core of that dressing. It's a really nice, soft and conformable dressing that molds nicely to the wound. It fits quite nicely, and there's a big range of dressings there to actually help you fit the right dressing to the right wound. One of the really impressive things about ConvaMax is the fact that you can use it either as a primary or as a secondary dressing. So you can use it in conjunction with Aquacel dressings or Aquacel AG+, depending on what you're trying to achieve with that wound bed. If it's just actually managing the exudate, ConvaMax on its own is great. If you want to debride or deslough that wound, then you can use it in conjunction with our hydrofiber dressings.
It's really, really interesting.
So as you can see, we've got a large range of dressings available. There are 9 non-adhesive and 2 adhesive versions of ConvaMax and part of our ConvaTec family. So we can now offer clinicians a really good range of dressings to manage their exudate and give really good patient satisfaction.
Right, that's really interesting. Thanks for that, Lisa. Can I ask you a few questions about it? That's great. What are the 3 main benefits? So we've seen lots of benefits of the ConvaMax, but if you could say the 3 main benefits, what would what would you choose?
I think for me the three biggest benefits would be the fact that firstly it's a very absorbent dressing. It will absorb that exudate, it will lock it in, and you know that even under pressure that exudate's not going to come out and cause problems for the patient or that peri-wound skin that can be really fragile. I think the second thing would be the fact that it's very soft, it's very conformable, it's a very tactile dressing, and patients like to wear it because it does feel nice and soft, especially under things like compression bandaging. And I think the third thing is that we've got all that in vitro testing that shows that ConvaMax can be used in conjunction with our hydrofiber dressing. So you can use it with Aquacel if you want to manage the wound bed in that way, or you can use it with Aquacel AG Plus should you have infection or suspect a biofilm to be present. So the two together work really well in partnership.
And those are three really key points.
Yeah,
aren't
absolutely.
They? When and where is ConvaMax available? Where can we get it?
So at the moment it's available through Amcare, so you can get it through Amcare, or you can order it directly through ConvaTec. However, from the 1st of May it will be actually available on drug tariff, so clinicians will be able to prescribe it at that point.
You can get it through the prescribing route as well.
Yeah.
Right. And are nurses or clinicians, any clinicians, able to trial the ConvaMax? If so, how do they get in touch?
Yeah, no, absolutely. I mean, we really would like as much feedback as we can get from our clinicians, and especially the patients that are wearing those particular dressings. So if it's something that somebody would like to do, I think the best way to go about it would be to contact the ConvaTec representative in the area and arrange a meeting, and then that can be discussed how you want to do that evaluation. If you don't know who your ConvaTec rep is, then you can always give our wound care helpline a ring on 0800 298 738.
That's brilliant, thank you. But if we want to find out more, this is 10 minutes of us having a discussion about the ConvaMax, but how can we find more out about the product moving forward?
Yeah, so there's absolutely loads of ways you can find out more. As you can see on the screen, you can speak to your local ConvaTec representative, you can phone or email our ConvaTec wound helpline, you can visit the ConvaMax website. I think the thing to remember is you can get it now through Amcare, but from the 1st of May you'll be able to prescribe it and get your own experience with the dressing. Yeah.
That's super. Well, I found that really, really interesting. Also discussing about the problems with exudate management as well as introducing the ConvaMax to us. So thank you, Lisa. That was really interesting. And thank you very, very much for watching. We hope you found this session useful and hope you'll join us later today for more Facebook Live sessions. Thank you.